a new witness. If we are ready with the witness, please proceed.
Thank you, Mr. Chair. We have a new witness for this afternoon who will be led by Ms. Mariama Singate.
Thank you.
Thank you very much, Mr. Chairman. Good afternoon, Mr. Chairman. Good afternoon, Commissioners. It's good to see all of you here. Mr. Osher, can you please help us with the witness?
I, Fanta Sanneh.
I, Fanta Sanneh.
Do swear that.
Do swear that.
I'll speak the truth.
I will speak the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
So help me God.
So help me God.
Good afternoon, Madam Witness.
Good afternoon, ma'am.
Welcome to the TRC.
Thank you, ma'am.
As you already know, my name is Mariama Singate, and I'll be guiding you through your testimony this afternoon.
Okay, ma'am.
For today, we will be dealing with your background information and the procedure at mile 2 with respect to the medic unit, the referral, the procedure for referral to RBTH. We'll also be dealing with the issue of deaths of inmates, what occurs after the death of an inmate. And we will also like you to tell us about the incidents of human rights violations that you have witnessed at mile 2 prisons. I'll request that you speak into the mic when you answer the questions, and you give short answers so that the interpreters will be able to interpret as we go on. And if you do not understand any of my questions, please do let me know. I'll rephrase the question so that we can have a smooth testimony this afternoon.
Okay, ma'am.
To start with, can you please tell the Commission your name?
My name is Fanta Sanneh.
What is your date of birth?
I was born on September 9th, 1979.
Can you tell us where you were born?
I was born in a village called Pirang.
Can you please give us a summary of your educational background?
I attended Pirang Primary School from primary 1 to 6. From there, I sat to my grade 6 exams, and I proceeded to Bottrop Junior Secondary School in Brikama, where I spent 3 years from grade 7 to grade 9. I sat to my exams again, and I proceeded again in the same school from grade 9 to grade 12.
Can you recall the year you completed your secondary education?
I completed my secondary education in 1998.
After your secondary education, did you go further in your studies?
No.
Secondary, I'll assume that would be grade
12.
12?
Yeah.
That's senior secondary, right?
Senior secondary, yes.
So when did you complete the secondary? That's before the senior secondary.
No, you complete the junior secondary, then you go in for senior secondary.
Was in 98, right?
98 years.
And in senior, when did you complete?
No, the senior is what I mean. That one I completed it in 1998.
Okay. How about the junior? That is if you can
It
recall.
is a continuous procedure. Then if you have your 3 years, you start your grade 9 exams, then you continue from grade 9 to grade 12.
Thank you very much. After your senior education, can you tell us if you've pursued further education?
No, I did not pursue further education.
What did you do afterwards?
Afterwards, I decided to join the prisons in 2003.
What were you doing in between from 1998 to 2003?
I was doing nothing. I was staying with my elder sister.
You joined the prisons in 2003.
Exactly.
Can you tell us how long your training lasted?
Our training lasted for about 8 months.
Can you please give us a brief summary of what your training entailed?
Our training, what it entails is the normal drill. They will teach you about the act, and that's all.
After your training, can you tell us where you were posted?
After my training, I was posted at the main gate as a gatekeeper.
What were your duties at the main gate?
I was posted there as a gatekeeper to be keeping records, movements of inmates going in, going out, officers going in and going out, all the movement that take place at the gate.
And how long did you remain in that position as at the main gate?
I remained there from 2003 to 2005 when I was notified to go to the hospital for a training course.
Prior to you being notified to go for a training at the hospital, did you serve in any other department at the prisons?
Not at all.
Can you tell us how you were identified for this particular training?
The identification, definitely, I can't tell, because I was at the gates and somebody came and told me that there is a notice on the notice board that you have to report to the hospital on so-and-so date for a training course. So I don't know how the selection was done.
What kind of training was that?
It was a basic on nursing training course, basic in nursing training course.
How many of you were selected for this training?
4 of us were selected.
Can you please give us the names of the other 3?
Myself, Karamba Bojang, Fansu Sanyan, sorry, and Nancy Mendy.
Before you went for the training, were you given any rank?
No, I was a private.
And where did this training occur?
At the RVT, presently named as RVT, Edward Francis Small Teaching Hospital.
What did this training entail, the training at the hospital?
It entailed about knowing the basics in nursing.
Who were your instructors during this training?
They were doctors at the hospital and qualified nurses.
What kind of basic things were you trained on?
We were trained on how to take care of patients that will fall ill at an early stage, meaning like first aid treatment for a patient.
How long did this training last?
It lasted for 6 months. We did our theory and then practical. Then an exams was given to us. After the exams, then we proceeded on our practicals in the hospital.
What kind of exams was given to you? Was it oral or written, or practical exams?
It was written and practical. After our written exams, then we went in for the practical.
And after your exams, were you certified?
Yes, of course, I was certified.
Were you the only one that was certified after the exams?
No, ma. The three of us, because the third one couldn't complete it, so the three of us were certified.
And that would be you and who else?
The two boys, Fansu and Karamba.
So only three of you completed this training?
Exactly.
Usually the normal nursing training, that is, if you're aware, takes about 3 years in the Gambian curriculum. And you guys were only trained for 8 months. Do you think that that training was sufficient for you?
It was sufficient for me, I think, because it was just to take care of the basic health care, not going in deep. The basic health care for the people.
After this basic training, what else did you do?
After the basic training, I came back to the prisons.
So you mentioned basic health care, and you also said earlier, like first aid. In your opinion, what will the basic health care entail?
Meaning taking care of those with minor cases, minor complaints. Yeah, those are the ones we will be solely responsible.
Can you please give us examples?
Like those with malaria cases, fever, lower abdominal pain, just to name a few.
After this particular training, the 6 months, did you go back to the prisons?
Yes, I went back to the prisons.
Can you tell us how that happened?
After our training, the then PRO went to our Director General and told him that, as to what he told us when he came back, he told us that I went to your Director General and I told him that you people have completed your training and you were certified. So you need to go back to the state central prisons. Normally, our procedure for this course is to make sure that our nursing attendants at the hospital here, we can select maybe 3 at every end of the training. We will select 3 people to go to the School of Nursing at Bansang. So I've told him that from there, this year, you people occupy these spaces. So he needs to sponsor, the department needs to sponsor you to go to the School of Nursing to pursue your nursing training. So he told us that the then DG agreed that he would do so. So we were sent back to the prisons. But when we came back, then we are stationed there still now.
So what happened to the recommendation that you were supposed to further your training?
Well, I don't know what happened. I didn't make a follow-up because I was thinking, hence they are seeing us there and the recommendation has already been given to them. They would do something, the authorities would do something, but nothing was done.
When you went back to the prisons, what unit were you attached to?
I was attached at the medical unit.
Can you tell us about this medical unit? How many personnel were working there?
We were almost about 9 personnel.
Does that include the 3 of you that did the
Exactly, yes.
basic training?
Exactly.
And that would be you, Karamba, Mpansu, and who else?
Majatu, Jatu Jame, Buba Jata, Suwaibu Jiba, Waf Kujabi, and late James Jaju.
Who was the head of this
And
unit?
Jared Lutu was there.
Who was the head of this unit?
The then commander was Commissioner Buba Jata.
Do you know if he was a qualified nurse or a medical doctor?
Well, I don't know what is his qualification. I can't tell.
Apart from the three of you that did the basic training, the rest, do you know of any trainings that they did to be part of that unit?
No, ma.
Was there anyone among you that was a qualified nurse or a medical doctor?
No.
So all the people in that unit were not qualified nurses or doctors?
Not at all.
Can you please tell us how the medic unit operated?
We have it still now. We have an infirmary there. There's a ward in and a small area there where we give our treatments to patients. The ward there will be used for admission of patients. Those who are discharged from the hospital will be maintained in that infirmary or ward for some time. If you are much better, then you will be discharged to join the other inmates in their cells. But the normal routine there for the inmates is, it is normal there. Anybody who complains of being sick is escorted by the officer to come to the infirmary for help or treatment.
Who are usually your patients?
All the setup there, the three types of prisoners we have there, the detainees, the convicts, and the remand.
And what complaints would they usually come with?
Different complaints: headache, fever, lower abdominal pain, diarrhea, and so on.
What was the most prevailing complaint in prison at that time?
Most of the time we'll say, they would be saying the way we lie down there, we go to bed, or general body pain will be most of them, that would be their complaint.
And when patients come in, can you tell us the procedure?
Yeah, they will queue outside, and they will be coming one after the other.
Would you usually have the medication that a patient needs when he complains of a particular illness?
Yeah, sometimes, but not always.
How often was that you will always have the medication that a patient needs?
It depends on, we get our supply, we request for our supply in every month once. So if it is in an early stage, at the moment in the early days that we receive the medicine, maybe sometimes when you come, we will have all the drug at stock. But sometimes if it goes on maybe in the middle of the month, then drug shortage will start to come in.
We have received evidence that the only drug that will be available in most cases at the prison infirmary will be paracetamol.
Yeah, that could be true, because that paracetamol will be requested more.
Sorry, I need to cut you there. You said could be. That there's a difference between something that could be true or something that is true. So I need a specific answer to that.
Yes, the demand for paracetamol is more than the demand for other drugs. Hence, the complaint of this pain is more than any other complaint. So we will request more of analgesic drugs than the other ones.
Correct me if I'm wrong, but if the demand for a particular drug is high, that means that drug will be scarce in most cases and other drugs will be readily available.
Yes, that is true, but depending on the way you requested for it. If you request more than the ones, the non-demanding more ones, you can still maintain it. It can still be there for a month.
We have received evidence from the current DG of prisons, who also told us that there is usually, in most cases, a shortage of medication at the prison infirmary. Is that true?
It is very true, and even in the present days, it is happening there.
Given the case that there is, in most cases, a shortage of medication at the prison, would you say that the prisoners usually have the medications that they needed when you prescribe the medication for them?
They will not, they will not be having all. As you know, even at the main hospital, if you go to see a doctor, whenever drugs are prescribed to you, you won't be able to get everything at the hospital. You need to go to a pharmacy to purchase some of these drugs. Likewise, the prisons.
But in the case of the prison, you have prisoners that are under the custody of the state, and they don't have the liberty to move around and buy their own drugs. And somebody that is in the custody of the state should be given the required treatment that they need and medication that they need as well. So in such cases, are the medications usually available to the prisoners?
Most of them are available because we contact their family members. I personally will call their family members. If you have somebody who will buy the drugs for you, I'll make a call to the person to come for the prescription paper to go and buy the drugs for you and bring it to us.
You're committing yourself here by saying that most of the medications are available to prisoners. Is that what you're saying?
Yeah, I was saying not every medication will be available for them. Not all. That's why I mentioned the case of RVTH. Even other hospitals, if you go there, not every medication will be available for a patient. Even the inpatients, you have to go to a pharmacy and purchase some drugs for the patient.
That may be true.
So the prisons will not be an exception.
That may be true, but the prisons is a different institution. The prisons is an institution that is housing people that have been detained there by government. So that's a totally different issue. We are talking about the prison setup itself and whether prisoners had access to the medication that they needed.
That definitely is the government, because had it been they've made everything ready for the prisoners, we have enough stock at hand, they will not lack anything.
But there was a shortage of medication at the prison.
It happens, even as at now.
Good. What happens in the case where an inmate comes in and you check the inmate and you realize that you cannot provide the essential treatment for that inmate?
The patient is referred to the main hospital immediately.
And this referral, how is it done?
It's done by us, the medics. We will prepare a referral form. We have a referral form there where we will fill your complaints, everything, your name, your age. Then we send you to the hospital for proper checkup.
We have received testimonies of inmates being denied medical attention. What can you tell us about that as a medic at the prisons?
That could be something true.
There's a difference between could be and it's true. So you have to be specific when answering such questions, please. Thank
okay, ma'am.
Please answer the question.
Yeah, that is true. Well, it's a rare thing.
Rare, you're saying, eh? Can you please give us instances where an inmate was denied medical treatment?
No, I think I witnessed that all at once. if my memory can serve me well. I think I can remember only it happening once.
Can you tell us about that?
It was one detainee who was there. I don't know, he complained to my commander, but I don't know what was exactly he was complaining about. So he was to go to the hospital, and my commander made recommendations for him to be sent to the hospital, and he was denied.
And who was this detainee?
It was CDJT.
Do you know why he was denied medical treatment?
Well, I don't know.
Adam, can you please tell us why he was denied medical treatment?
Okay. They said he has just come into the prisons, and most of the people don't know his whereabouts. And also he's a public figure, so.
In essence, they were trying to prevent people from knowing that he is actually detained at the prison.
Exactly, yes. That was my perception. That was what I think, yeah.
What category of prisoner was he? You gave us three
He was a
categories.
detainee.
And can you explain what a detainee was in the terms of Mile 2?
Detainees are prisoners that come political prisoners who are brought without warrants.
And this individual, because he was a prisoner that was brought without a warrant, they did not want people to see him outside.
Exactly.
That was why he was denied medical treatment.
Yes, that was what my commander explained to me.
Can you tell us who your commander was?
It was the late wife Kujabi.
And who denied the treatment?
Pardon?
Who was it that denied this particular individual the treatment he needed?
He went with the paper. You know, we have a paper where we write all the list of names, the names of the inmates going to the hospital every day. So when he took it to the authorities, so when he came back, he said this one must be cancelled. Then that was the time I asked him the reason why his name was cancelled. When he took it, every day he would take the paper to the authorities for them to confirm people going to the hospital.
When you say authorities, who are you referring to?
The Director General and the Operation Commander, those above him.
Who was the Director General at that time?
It was David Colley.
And the Operations Commander?
You know, Operation Commanders change time to time, so I don't know the exact Operation Commander who was there.
Can you recall the year this happened?
I think it was Ibrahim Ajami.
Can you recall the year it happened?
No, Ma, I can't. I think it was in 2016, I think, if my memory can serve me well.
So can you tell us the relationship between the medic unit and the RVTH at that time?
You mean our relationship?
Yes.
We have a good we have still now a good relationship with them.
So how would you work hand in hand together in ensuring that the prisoners receive their much needed medical attention?
Anybody referred to them, they will definitely attend to them. And the necessary treatment will be given to them by the RVTH staff.
We have also received evidence that most of the cause of death with respect to prisoners was as a result of an illness known as beriberi. What can you tell us about that?
That is true. It is commonly found in the prisons. That's true.
Can you tell us what the cause of this disease was?
As we know, beriberi, it is a disease caused by lack of proper intake of nutrients. So that could be.
When you receive an inmate, how do you determine whether he or she is suffering from this illness?
The person will be having generalized edema. Sometimes the legs will be swollen up to the top, and if the moment you pinch your finger on, then the finger will go deep, and it will, before that the skin will rise up again, it will take time.
When you diagnose an inmate of this disease, what recommendations do you, if any, do you usually make concerning this particular inmate?
If it is detected early, then we will go to the kitchen and inform the kitchen in charge there to be giving him or her some pepper soup diet.
We have received evidence that the diet of the prison was generally quite poor. And it is as a result of that diet that prisoners were suffering from this beriberi. This pepper soup diet you're talking about, can you tell us about it?
Well, before I don't know how it was going about, but at the present, this present time, as I took over as the OIC, is what I'm talking about.
As a unit in the prisons, sorry, my apologies. Okay. So you're talking about the present times?
Yes.
Before, was this happening?
Yes, this pepper soup diet has been there for long now.
How long?
They call it before high protein, but now we call it pepper soup diet. But that time, before, I don't know how it was going on, definitely.
Can you, sorry, my apologies. Can you tell us more about this high protein diet? Who will make a recommendation for a prisoner to receive this high protein diet?
Myself or the doctor coming in?
Over the years, have you made such recommendations?
Pardon?
The years as a medic at Mile 2, have you made such recommendations?
When I took over as the officer in charge, I've been doing it. I am doing it.
And during the time you started with the medic unit, what was your rank at that time? The time you started at the unit?
I was a private.
And during that time, were you making such recommendations as to the diet of prisoners?
Not at all.
Who was doing that?
My superiors.
And that would be WAF and who else?
Whoever takes over as the in charge will be responsible solely.
Can you tell us in your unit how you alternate daily?
We will be there as women. We will be working from 8 to 4, and there would be a male officer stationed at the quarters there who will be taking care of the afternoon shift and the night shift for any other complaint from the inmates.
When you started, for how long did you work at the medic unit?
Since I came back from the hospital in 2007.
To when?
To date.
So from 2007 till date, you've been working at the medic unit?
Exactly.
In all those years, were you stationed at Mile 2?
No. When I came back from the RVTH, I was there up till from 2007. In 2008, I was moved to Joshua. 2009, I was transferred again to Makati, from Joshua to Makati. I spent 1 year, 3 months in Makati. I came back. Then, when I came back in 2011, towards 12, I was enlisted for to join these people for DAFO mission exams and other things. God been so helpful. I was lucky to be part of those going to Sudan. And in 2013, I left for Sudan. I was there till 2015. I came back in May 31st.
So from 2005 to 2008, you were stationed mainly at the Mile 2 Medic Unit?
Yeah, from 2007 to 2008, I was at Mile 2.
Great. So during that time, apart from the complaints, the usual complaints of headaches and the beriberi symptoms, have you had any other peculiar complaints from inmates?
No.
Have you ever received any inmate that suffered any form of injuries?
During that time, sometimes they will be fighting each other, and eventually one of them will be injured, and he or she will be brought to the clinic for treatment.
Is it only fighting each other that will resort to injuries?
Yes, then what I can remember, then fighting.
Can you tell us about can you tell us about the inmates that suffer from this beriberi that you told us about? Can you tell us for how long this illness lasts when it comes to a particular inmate?
You know, every illness depends on your body immune system. If your immune system can fight the disease, you can have a speedy recovery. But sometimes if your immune system is weak, obviously the disease will definitely disturb you, and eventually it may cause loss of life.
Have you witnessed any incidents of death of an inmate as a result of this sickness?
Yes.
How many?
I think 3 or I don't know.
And given that it was like the most prevailing illness that was resulting in a prisoner's death, was there any concern raised by the medical unit of the prisons to the bosses then at Mile 2?
Yes, the concern was raised among us, but then it will end up going to our superiors. So it is left to them to see a way out how to handle it.
Do you know if your bosses complained to the superiors about this prevailing illness and that it was killing prisoners and something needs to be done about it?
Well, we will discuss it among ourselves there, but whether the message will be related to the superiors there, I cannot tell, because then I was a very junior officer. I was not going to my superiors.
But then again, if you converge with your superiors, you must have discussed these issues amongst yourself, correct?
Exactly.
What will the discussions be like?
But he will be telling me we will talk to the authorities concerned, but I don't know how true it was.
And given that the beriberi is also as a result of lack of a particular vitamin in the diet, do you know if the authorities did anything about the diet within that particular period?
I can't tell that, ma.
You were a prison officer, right?
Exactly.
I'm sure you must know the diet of prisoners, not so?
Yeah, but I don't work in the stores, and I'm neither not working at the kitchen.
What you did hear about the food that was given to prisoners?
Yeah, I will see them serving it to them, but it is not my EOR, so I don't go
So
there.
how did you perceive the food that was being served to prisoners? How did you see the food?
I don't go to stand by there to watch what they are being served with.
But you did see the food.
Sometimes I will see the food.
So you saw the food?
Yes.
And you can form your opinion based on what you saw, not so?
Exactly.
So can you tell us about that?
Before?
Yes.
No, before it was rare for me to go to the kitchen. Definitely.
The prisoners that were coming to you, did they tell you anything about the food?
Yes, definitely. They will be coming. If they come to the clinic, they will be complaining of the food. That's true.
And what were their complaints like?
They will be saying the food is not delicious. The food is not delicious. The food is not good. They will be complaining such things to us.
And being a unit that was in charge of the health of the prisoners, did you raise these issues with the authorities and let them know that the prisoners are complaining about the food?
Well, then it was not my responsibility. I don't know whether it was raised to the authorities or not.
But you were working in the unit, and the unit was fairly a small one.
Exactly, that is true. But in service, we are concerned about seniority. When a complaint comes, I will give it to this one, my next superior man, man who seniors me. Then it goes up like that. It goes up like a ladder. This is what happened in the service setup. So I don't know. Maybe when they come and complain to us, our senior officers will be there. They will hear it. So whether the information is related to our superiors there, I would not know, because I was very junior. I was rankless even then.
Even with you being rankless at that time, you were serving in a very small unit.
Exactly.
And the advantage of serving in a very small unit, correct me if I'm wrong, is that there is not much limitations when it comes to junior and senior. You are in a close unit with your superior, so you become familiar with your superior. Am I correct?
That is true. You are correct, ma'am. But whenever he comes back or they come back, if we are not fed with anything, they didn't tell us anything, so we won't be interested to know whatever results they got from there. So we continue, we carry on our duties and on our work, other errands.
Can you tell us from 2007 to 2008, before you left the infirmary, the medical unit, can you tell us if there was any significant improvement made with respect to the complaints that were coming up and illnesses that were very common?
I didn't see any significant improvement being taking place there. The same thing, what was going on was what was going on.
And can you tell us what your duties were when you were transferred to Joshua?
When I was transferred to Joshua, it was the same duties as a medic at Joshua.
Was there any difference between the medic unit, how it operated at Mile 2 and Joshua?
There is no difference. You will be there to be seeing the inmates who will come and complain to you, or officers will be bringing complaints to you that Mr. So-and-so is complaining, being sick. Then you will ask the officer to bring him to you, to where there is no clinic. We sit under a tree. Then we have a table there. Then we will put our drugs there. So inmates will be coming one after the other, escorted one after the other. Then we will see if still you complain today, tomorrow symptoms persist, then we refer you back to mile 2. We make a referral, we send you back to mile 2 for further management of your ailment.
Did you have any access to medication at Joshua?
Yes, we take our supplies from mile 2. When they get the supplies from Brikama, then we will go and get our own from there.
Why would you usually refer inmates to mile 2 prisons?
So that they can get proper treatment. They can be referred to the RVTH for proper management.
The treatment that they receive at Joshua and the one that they receive at mile 2, what is the difference there?
There won't be any difference because we will write all the treatment given to him. And that would be the medicine still at mile 2. So the reasons for the referral to mile 2 is for him or her to be it is him because we don't have female prisoners at Joshua. For him to be referred to Joshua for proper management, to the RVTH for proper management. That's the only reason why we transfer them back to mile 2 so that they can be sent to Joshua, RVTH.
And correct me if I'm wrong, but even at the time of your transfer to Joshua prisons, there was no qualified medical personnel at mile 2 prisons, correct?
Mm-hmm. Yes.
What kind of complaints would you usually receive while you were at Joshua prisons?
The same complaints as to what we were receiving at mile 2, the same complaints.
Did you have any complaints relating to beriberi?
Yes, but it was not common.
Not as common as mile 2?
As mile 2, yes.
Why do you think that was the case?
Well, could be. The way they are set up there is different from the way they are at mile 2.
Was the food better at Joshua than mile 2?
Could be, because you have less people there than at mile 2. So obviously the food would be different.
Say,
if you have a small setup and you have to cook for as many people as those at mile 2, it will be a different diet.
When you say could be, I'm not sure what your answer is. So I need a definite answer. Was the food in fact better at Joshua prison than mile 2 prisons?
Yeah, I don't know.
From your observation, that is.
Yeah, could be.
You're saying could be again. That's
yes.
Not very certain.
Yes, ma'am.
Okay, for how long did you remain at Joshua?
Joshua, I was there until 2000 and I think I spent a year there. Then I was moved to Makati.
At Makati, were you still a medic?
Yes.
Can you please tell us about the setup at Makati?
At Makati, I was there as a medic. But Makati, they are near, the prisons is very close to the health center. So as soon as I am ready to go to work, I will walk into the prisons. Then the officers will be telling me sick report. I will go and collect the names of those who are complaining sick. I will give the list. I will go, I was standing by the window. So I would telling them, asking them any sick report. They would say, one day, they will come one after the other, giving me their names. So I will hand over those names, the list, to the officers to bring them for me at the hospital. I was permanently stationed at the health center. I was working at the health center.
So would you say that your work at Makati was easier than in Joshua and Mile 2 prison?
Exactly, because I would take the names, hand over the names to the officer, and they will be bringing the inmates to the health center. I was stationed at the health center.
So the inmates at Makati prison had access to hospital care than Mile 2 and Joshua?
Yes, they will be taken every day to the hospital. Any complaint, you are taken to the hospital.
How long did you remain at Makati?
I was there up for 1 year, 3 months.
Did you receive any complaints relating to beriberi at Makati?
At Makati, no, if my memory can serve well, I don't think.
The diet at Makati, was it also the same as in Mile 2 and Joshua?
Yes, I think they all work on the same menu. The menu served at Mile 2 will be served at Joshua and Mile 2. At Janjambure.
But was it better?
The food? No, I don't usually see their food because they cook behind. And female officers going behind is forbidden. So I don't normally go behind. I'll be in front, go by the windows, and I'll be asking them, whoever is sick, I will get the name. Then I leave the prisons. That was my job in the prison. Getting their names, I go back, I go to the clinic early in the morning. I go to the health center.
Okay, you told us that after serving at Makati, you were back and then you were identified to go to Sudan for peacekeeping.
Exactly.
And when you returned, you were back at Mile 2. That will be 2015.
2015 years.
Can you tell us about your return to Mile 2? Where were you posted?
I went back to the clinic.
Did anything change then after being away for so long and then back at the clinic?
When I came back, you mean? The only thing that changed is when I came, I met a structure there built by the Global Fund. Yeah.
That's a clinic setup, that is?
Yeah, that is the building outside when going to the remand wing.
What of access to medication? Did it improve in 2015?
No, the same procedures were going on.
The same shortage also?
The same shortage.
What of prisoners being denied of medical treatment? Was there any incident of that sort at that time?
No.
Not that you've witnessed, or no?
The one I told you I've witnessed is within that range, within that period. That was, I think, in 2016.
It was around 2016?
Yeah, 2016.
Can you tell us if you have treated any prisoner of any form of injuries that is unrelated to prisoners fighting amongst themselves?
That happened there only once, I think, when they came to me that they have sustained some back bruises and yeah.
Can you tell us about that?
Yes, they came to me at the clinic and said they have general body pain and back bruises. What not serious?
Do you know what caused those bruises at their backs?
Yes, of course. I asked them and they told me they were beaten.
Who were those prisoners?
It was Makodu and Daminja.
Do you know who beat them?
Really, I don't know who beat them.
Did you come
Because
to
I was
find
not
out?
there.
Sorry, you can continue, please.
I was not there, and we are even far away from each other. They are at the other end, I'm at the other side.
Well, when they told you that they were beaten, do you know who the they that they were referring to? Do you know who they were?
No, they obvious, definitely asked them, beaten by who? But they tell me Ibrahim Jame and the group and others, I don't know.
And who was Ibrahim Ajame?
He's a chief superintendent. I don't know him much.
And do you know why they were beaten?
Well, I don't know. I asked them the reason why, but I've forgotten what they told me was the reason why they were beaten.
Can you tell us their condition then when they came in?
They were not in a bad state because we were sitting, chatting, but the only thing they were complaining was general body pain.
Did you see their injuries?
Yes, Makodu removed his hat. He used to call me Yumpany, and he said, Yumpany, holal suma ganaubi. Yumpany just looked at my back. So I have a look on his back, and I saw some bruises on his back.
And these bruises were caused by prison officers, right?
Yes, that was what he told me.
Were prison officers allowed to beat up prisoners?
Those are operational matters. I don't know.
They may be operational matters, but then again, you are familiar with the Prison Act, that is. Under the normal circumstance, are prison officers allowed to beat up prisoners?
No. They have a punishment attached to whatsoever bad thing they do, but beating them is not in the act.
So it was unlawful for those prison officers to beat up these prisoners, correct?
Very unlawful.
Was anything done about that when it happened?
No, I just gave them the treatment, then they are gone. I don't know. Those are operational matters. My concern was to give them treatment and let them get well. That was my area.
I know that they may be operational matters, but in a small unit like a prison that is almost like a village setup, you hear things here and there. Once you are in that village, you have access to information. So obviously you must have heard something about that particular incident.
No, I didn't have anything after the incident.
Do you know if the management of prisons was aware that this incident happened?
Hopefully they will be aware, for sure.
And nothing happened to the individual that carried out this beating on the prisoners?
I don't know what happened to them at the end, but I definitely can tell.
Apart from Makodu and Jah, did you witness any other incident where a prisoner was beaten, or did you hear of any other incident where a prisoner was beaten?
Not at all.
How about deaths that occurred in prison?
If it is during my time, I can tell you about that.
So you're telling us that you are not aware of any deaths that occurred in prison?
Of course, I will be aware.
Can you tell us about it? The ones that you are aware of.
As to what time?
As to the time that you were in prison, that is from 2005 to 2016 or 2017, if any.
Ma'am, if only you can name names for me, but definitely I don't think I will be able to remember.
Okay,
their
I
names.
have a list of deaths that occurred in prison, and I'll give you the names, and you will tell us if you know anything about it.
Okay.
Do you know of the case of Ibrahim Juf? This was in 2015.
I don't know Ibrahim Ajuf. I can't remember him.
Did you hear of the case of Ibrahim Juf in 2015?
Not at all.
Ibrahim Juf was, according to our investigation, he was stamped on the ribs by Chief Kalilu Sanneh, and he was locked up at confinement wing number 5. 2 days after the incident, he passed away.
I heard of this case in these sittings, TRRC, but I don't know. I can't remember even hearing that incident at Mile 2.
As a prison officer and also as a medic, you're telling us that you've never, ever heard of this particular incident.
It could take place before I came back from Sudan or in the period I was on leave. It could take place during that period.
These are incidents that even if you come back from leave, you must have heard the gossip about.
Mom, I was never told.
We'll leave it at that.
Okay.
I'll go to another incident, the case of Lamarana Jallo.
I don't know Lamarana.
This also happened in 2015.
I don't know this Lamarana. I can't remember him.
Lamarana allegedly fought with a colleague, and this led to his torture by prison officers. He died as a result of the torture 2 days afterwards.
Ma, I can't remember this Lamarana.
I'll go through the list.
Thank you, Ma.
Are you aware of the death of Solo Kuruma?
I am fully aware.
Can you tell us what happened to him?
Solo, when he came to the prisons, as soon as he came to the prisons, he started complaining of severe headaches, dizziness. Yeah, that was his major complaints.
From our own investigations, it is alleged that Solo was brought in RVTH when he was already dead.
That is not true, Ma.
What can you say about this particular incident?
Solo has been complaining of these symptoms, and we've been trying to give him medicine. So one day, my junior officer called me that Solo, the symptoms has persisted and he cannot even stand. So I told him make an immediate referral to the hospital. Then Solo was evacuated to the hospital and he was hospitalized. And if my memory can serve me well, he even has undergone surgery.
In 2016, what was your rank?
I was an inspector.
And what was your position at the medic unit?
Then my superior was moved to Joshua. Then I took over as the head.
Meaning you were officer in charge,
In charge at Mile 2.
at the Mile 2 prison.
Yes.
So in 2016, you were already aware of first-hand information? Not
Yes.
so?
Yes.
What can you tell us about Madi Gabi in 2016?
Madi died of generalized edema. That is very, they call.
And
no, let me rectify myself. He was referred to the hospital due to generalized edema, because I'm not a doctor to say what killed him. I don't know what was the diagnosis at the hospital.
it's safe for you to say that, actually. So Madi died of beriberi.
I don't know, but he was admitted at the hospital.
So that means till 2016, beriberi was a prevailing illness at Mile 2, correct?
Yeah, we were still having cases.
And
But
this
not
time
us.
around,
Huh?
this time around, you were the officer in charge of the medic unit.
Positive.
Now, when you saw that this case of beriberi that you witnessed after you started at Mile 2 as a medic officer, to the point where you were promoted up to officer in charge at the medic unit, when you saw that this was prevailing at the prisons, what did you do about it?
I was just trying for them to define. Immediately I suspect a case, I will make an immediate referral to the hospital.
Knowing fully well that it is caused by a vitamin deficiency, what else would you do?
That was the only thing I was doing.
Did you raise the concern as to the diet of the prisoners?
No, I didn't raise a concern.
But you knew fully well that the prisoners were suffering from this illness as a result of their diet, correct?
Yeah.
Having this knowledge, did you do anything about it?
No, I did not do anything about it.
Can you tell us why?
Because it has been prevailing there for long, and I didn't see my superiors saying anything. So the only way I was trying to do is to make sure that they restore their health back. That is rushing them to the hospital. Whenever I suspect a case, I just take an immediate action. That was what I was doing.
And in the case of Bakari Dafe as well, do you know what happened to him?
Yeah, I know Bakari Dafe.
Can you tell us about it?
He also died of the same. He also showed the same symptoms as Madi Gabi.
And even after his death, knowing what caused it, nothing was done about the diet, correct?
Nothing was done about the diet. This diet issue, I don't know whether something was done or nothing was done. I don't know.
Given that prisoners were still dying of the same illness, so it's safe to say that nothing was done about it till 2016, correct?
Maybe council, I can't tell about that much because I don't work in the stores, neither at the kitchen. So diet changes would be a problem for me to answer, definitely.
Thank you very much. I think this is a convenient time for us to stop. Mr. Chairman, I've just been signaled that it's already time for our break. Maybe when we come back, we'll continue from where we stopped.
Thank you, Council, and thank you, Madam Sanneh. We will take a 1 hour break and come back at 2:45. Meeting is adjourned. Thank you.